Hi, have you recently noticed a sudden gain in weight, or have you suddenly dropped weight? Do you also find that you feel very tired all the time, or maybe you're noticing the thudding of your heart inside your chest, like palpitations? Well, if you have any or all of these symptoms, your doctor has probably recommended you get the FT4 or the free thyroid 4 thyroxine test done. And today I'm going to tell you everything that you need to know about this test. The free thyroxine or the FT4 is the actual active part of the thyroid hormone that regulates everything in your body. The thyroid makes a couple of different hormones. These are called T3 and T4. Out of this, the T4 is the one that actually has all the functions of the thyroid, that actually makes all the effect of the thyroid, like regulating your heart rate, regulating your weight, your fertility, and so many other things. But even the T4 is not completely active. There is a small part of the T4 which actually does the real work. This is the part which is free. It is not bound to any proteins in your blood. It is actually circulating around free in your blood, and that's why we call it the free T4 or the free thyroxine, and that is what this test measures. What are some symptoms that may mean that you should be doing the free thyroxine 4 test or the FT4 test? So on this page, I've included a list of some of the important symptoms that you may see. These include things like fatigue or feeling tired all the time, problems with temperature. You may find the temperature to be too warm when it's not, or you may feel very cold when it's actually too warm. Next, weight changes. You may rapidly drop weight or you may rapidly gain weight. You may notice your heart thudding in your chest. You may have hair fall, dry skin, and you also may have very weak muscles. Together with this, you may also notice problems with your fertility. All these things are suggestive of something wrong with your thyroid hormone levels, and that's why you should get this tested. So why would a doctor advise a FT4 test in your case? The first and the most common sign is if your doctor suspects something wrong with your thyroid gland. This is usually not advised directly, but you will go in maybe just for something called a TSH test, which is usually done to screen your thyroid. And if your doctor sees that your TSH level is not normal, they may then advise an FT4 test, which is the one that we're talking about. So it helps us to diagnose things like hyperthyroidism, where your thyroid acts too much, it overacts. It also helps us to diagnose hypothyroidism, where your thyroid does not act sufficiently, it underacts. Together with this, also in patients who are being treated for thyroid problems, we use this test to monitor whether the treatment is going on correctly or not. Lastly, it also helps us to find whether there is something wrong with the pituitary gland, which is a gland in your brain that actually controls how much your thyroid should act. So these are the reasons because of which a doctor may advise that you get this test done. How is the FT4 test done? This is a simple blood test. There is no preparation that is required. You don't need to be fasting. You can provide the sample at any time. The lab technician will insert a needle into the vein in your arm and draw a couple of ml or cc of blood. This will be processed in the lab and you will be provided with a report, usually on the same day. It's important to remind the lab whether you're taking any medications for your existing thyroid conditions, because this can affect the results. Also, if you're consuming a lot of biotin, which is a certain type of vitamin supplement, please inform your lab, because it can interfere with certain equipment which is used to measure the level of this hormone in your blood. What is the normal level of the FT4 in men and women? I've included the normal ranges on this page. Please consult your lab, because depending on the equipment and in which area of the world or your race and ethnicity, the values may be slightly different. But by and large, these are the internationally accepted values.